speed of light. The shutdown, as awful as it was, would have gone on months if not years longer. Millions of additional lives would have been lost. New variants pose a real risk, and the Delta variant brought back masks and social distancing. But the vaccines have so far remained remarkably effective. The hope is that booster shots will guard us against future variants. Supply remains a problem in the developing world, but in the United States in particular, the real problem is not the vaccine. It's people's refusal to get vaccinated. Much of the reporting on the vaccines is focused on the achievements of Operation Warp Speed, or the vaccine makers themselves. Their contributions were enormous, especially in compressing the timeline of development and paying up front for vaccines that might not work. However, the truth is that the politicians and the drug companies could not have made these vaccines so rapidly had it not been for a small group of scientists who made the right decisions at the right time and may ultimately save the world from an even more devastating pandemic. Their stories are ones of incredible foresight as well as incredible luck. Their breakthroughs had quietly revolutionized vaccine science, and yet hardly anyone realized it or even frankly cared about it at the time. Even the scientific community was largely unimpressed as it was happening. Prestigious scientific journals rejected some of the key articles that would ultimately make the vaccines possible. This book will tell the stories of those scientists rather than the vaccine makers, with one exception. Moderna was chosen by government scientists to be the platform for the first COVID-19 vaccine because it offered such a speedy way of making vaccines. The company had been working closely for years with the National Institutes of Health on a coronavirus vaccine, so its story is integral to the story of the science behind the vaccines. One man in particular, Barney Graham at the National Institutes of Health, pulled all the threads together. He is the Jonas Salk of COVID-19 vaccines. His research into a coronavirus vaccine started nearly 7 years before this new strain would appear in Wuhan, China. His main motive for studying coronaviruses was less to save the world and more to explore the unknown. We knew so little about that type of virus, and that made the research more exciting, more likely to break new ground. But in addition to the potential for personal recognition, Graham also understood it was just a matter of time before we would see a new strain of coronavirus. There had been 2 novel strains of coronavirus in just a decade, and both of those, SARS and MERS, were frighteningly deadly. Fortunately, neither was terribly contagious. Given that there are thousands of additional strains in bats, it was a matter of when, not if, there would be another leap from animals to humans. If a new strain appeared that was highly contagious, it could prove devastating. It was critical to be prepared for the next one. The emergence of HIV in the early 1980s and the unprecedented effort to develop a vaccine also played a pivotal role when SARS-CoV-2 appeared. If you tried to develop a perfect virus to elude vaccines, you would come up with something like HIV. It has the rare ability to play hide-and-seek with antibodies. And even if the antibodies found the virus, HIV magically disguises itself through rapid mutations, rendering the latest batch of antibodies useless. Today, HIV is controlled with antiviral drugs that allow those carrying it to live normal lives. The drugs are so effective that those infected cannot transmit the virus, and even sensitive tests cannot detect the virus in those taking the medication. But the virus quickly comes back if you stop taking the antiviral drugs. That's why the quest for a vaccine is still ongoing. It took every bit of scientific know-how to come up with experimental vaccines, which to date have failed. But the science that went into that effort has changed our ability to develop vaccines forever. While HIV is a uniquely challenging virus, SARS-CoV-2 is a rather easy virus to defeat. With the proper antibodies ready to pounce, SARS-CoV-2 and many of its variants are quite helpless. Not only did the mRNA vaccines prevent nearly all hospitalization and death, but they prevented symptomatic disease more than 90% of the time until the arrival of Delta. And beyond that, real-world data showed that they even kept those who were vaccinated from being effective carriers of the virus, at least with the early variants. Even with the Delta variant, breakthrough cases remain the exception. While it is difficult to quantify,